Hi everyone. So my first video this week is all going to be about back pain. Back pain is by far the most common complaint that comes in to see me in the clinic. Now of course there's multiple different kinds of back pain, but the most common one would be the non-specific mechanical. So it's vague band-like pain on one side or both in the low back, maybe a small radiation into the buttock or into the thigh. Importantly though, no nerve root symptoms, so nothing like pins and needles, numbness or weakness. So no drop foot or unable to lift the thigh to the leg. Different though, if pain limits movement, that's not the same as muscle weakness. So I'm going to show you just two very simple stretches and one very easy mobility exercise to hopefully help you manage or avoid future back pains. With non-specific mechanical back pain, reoccurrences of pain are pretty likely to happen. Statistically that's the case, but what your aim in managing it has to be is to make each episode of pain as short as possible and make the interval between episodes as long as possible. So hopefully these little exercises will help you to achieve that. So we've come over here to the chart on the wall which shows all the muscles in the body, and by far for me the two most important muscle groups for trying to manage the low back would be the hamstrings here in the back of the thigh and the hip flexors, which primarily are the psoas, the iliacus and the rectus femoris, which is in the front of the thigh. Now I'm going to show you how to stretch these muscles. The names are pretty irrelevant, don't worry about that too much, but when we're stretching the hip flexors, generally they cross the front of the hip. The hamstrings, they're going to go across the back of the hip. We want to stretch them both. Now the objective of stretching anything is to take the two attachment points of the muscle further away from one another. So we're going to bear that in mind. If you want to stretch something that flexes the hip, what we're going to have to do is extend the hip. So the next one we want to do are the hip flexors. Now as I'm sitting here and you might be sitting in work, the hip is in a flexed position. The muscles that flex the hip are going to be on the front of the thigh and deep inside here in the pelvis. When you're sitting for prolonged periods throughout the day, these muscles will shorten. That's just the position that you're in, and maybe over time they may end up shortening even further. And it's a good idea to try and stretch these. So if these muscles flex the hip, if we want to stretch them, we need to extend the hip. Very simply we can do that by coming down into a kneeling position. When you're in this kneeling position, the knee that's on the floor will be the side that you will be stretching. And from here, what you want to do is keep your hips facing forwards, your chest nice and tall, and then very importantly, you need to lock out the hip in extension. If you don't lock out the hip will stay slightly flexed, and when you do this stretch, you won't get the maximum benefit. If you lock the hip, keep the chest tall, you should feel a little stretch already in the upper thigh and then toward the groin. And from there, all we're going to do is lean slightly forward. This shouldn't be a very large movement. Sometimes if you're in the gym or you're looking online, you might see people with a much bigger stride and they'll lunge for quite a long way. Yes, you'll feel a stretch doing that, but more likely you might feel a bit more down the thigh. The trouble with doing something gross like this is that you're forgetting to lock the hip, so you're not really keeping that hip in extension. And the other thing is people might end up dropping the chest. If the chest drops, you're creating relative flexion here at the hip, and same when you don't lock the hip out in extension. So it's about squeezing the glute muscles, squeezing the buttock, getting that hip to lock out, chest nice and tall, hips facing square ahead, and then lean slightly forward. Hold that stretch for 20 seconds, do it 3 times with a couple of seconds gap in between. They are the hamstrings. Hamstrings, as we said before, using the chart, are on the back of the leg here. Now they're going to cross the hip and cross the knee. So if we want to stretch them, because they primarily will flex the knee and extend the hip, we're going to have to do the opposite. So a really simple rule of thumb is if you keep a straight leg, straight as you can, and a straight back, and close up the angle in between, you'll be stretching those muscles. Now you could do that by putting the foot up on something, straight leg, straight back, lean forward to close up the angle. You could choose to sit down, straight leg out, straight back, close up the angle, or you could even choose to lie on the floor with the legs up the wall. Lying on the floor with the legs up the wall is quite a good one for many reasons. Firstly, it's completely passive. Your back's well supported and the legs well supported, and you don't have to do any work. If you're sitting down, the advantage of this one is that you can put all your weight into your opposite leg, through your elbow into that knee, and that will take the pressure off the low back. The standing reaching ones are a little bit more tricky because now you're introducing one leg balance and you might fall over. If you're doing this one, I prefer you to do it near a wall or something soft, so if you do lose balance, you've got something to hold on to. This isn't supposed to be a test of your balance. It will be trickier to balance whilst doing this, but there's no shame in holding on. What we want to try and do is achieve a stretch in the leg. For any of these stretches, I recommend doing about 20 seconds, 3 times, with a short gap in between. Now, really importantly, when we're talking about the lumbar spine, some people can't really imagine what's going on in their head. But the spine, whether it be the low back, the neck, or the mid back, or the thoracic spine, basically the vertebrae are all of a similar shape. You'll have these blocky parts here at the front. They're quite rectangular, look like children's building blocks, and they're called the vertebral bodies. Now, the point of them and the way they're designed is obviously to transmit weight-bearing forces, and that's why they have that blocky appearance, and that makes them very good for being stable, transferring weight-bearing force. Out the back, the posterior portion of the vertebra, we have 3 spinous processes. We'll have 2 coming out either side, here and on the other side. They're called the transverse processes, and out the back we have the spinous processes. Now, these are much finer. They're not designed for weight-bearing force, very, very slightly, but not as well as the vertebral bodies. And you can see these little gaps here. Now, these gaps or junctions, those are your spinal joints. They're called facet joints. The contact surface area between these is tiny compared to the contact surface area of the end plate of this vertebra, the disc, and the one below. That again is designed such so that it can transmit the forces really effectively. These tiny little surfaces back here, the joints, are not designed for that. That's why they're small. They're there to control your movement and dictate the movements, motions and directions that you can do. We're going to do a little mobility drill to try and improve the mobility of these joints. Pretty much everybody should be able to do this. If you're having a really acute flare-up, it might not be appropriate. But for everybody else, if you're trying to do this exercise is really good as a maintenance exercise and trying to prevent future reoccurrences of your low back pain. So give it a go. So for this little mobility exercise, you're going to be lying best on the floor. Use a pillow, obviously, for the comfort of the head and the neck. We don't want you to create any neck problems whilst doing this exercise for your low back. Now, there's 3 key things about this exercise. Keeping the ankles together, keeping the knees together, and keeping the shoulders on the ground. Hopefully you can follow this with me. When you're lying on your back, bend the knees up. Fairly decent bend at the knees. Make sure that the low back is pretty comfortable on the ground, not too big an arch underneath. You shouldn't really be able to fit your hands underneath the small of your back on the floor. As I said before, important factors here are keeping the ankles together, the knees together, and shoulders down. Once in this position, all you have to do is drop the knees from one side to the other, keeping those 3 things the same. There will be a temptation as you try to work your knees towards the ground to go beyond your end of range and let the shoulder hitch up. The shoulder needs to stay down. If you go beyond your flexibility and the shoulder creeps up, the benefit of the stretch is kind of lost. Come back and work within that narrower end of range of movement, and as long as you're going to your end of range, you'll always be pushing that boundary. Now, don't panic if you hear little creaks and pops during this. That noise is completely irrelevant. It's not a sign of bones moving in or out of position. That sort of language is very outdated. If you're seeing a therapist at the minute and they're talking about putting bones back in, get a new therapist. So there you go, that's the first video I've actually made. I hope you've enjoyed it. It's just 3 very simple ways that you can try to help prevent future low back pains or try to get rid of the one you currently have. Unfortunately, sometimes having pain is a great reminder to do these little exercises, but try to make it a bit of a routine, something that you attach to, that you do every day. Sometimes people will do those knee roll exercises when they're in bed, first thing in the morning or last thing before they go to sleep. The hamstring stretch, because it can be done when sitting, might be something you do before you start your day at work, when you first get to your desk, before you start work after lunch, and before you leave your desk at the end of the day. Attaching these exercises to things that are part of your routine is going to be so crucial to you continuing to do them. There's only 3 exercises. Each one, you're talking about 20 seconds, 3 times for each. So, it's not a huge task to do that once a day, twice a day. So if you don't do it and your back pain comes back, you have to take some ownership and some responsibility in this yourself. Hopefully you've enjoyed this little video, and if there's any other topics that you would like, of course let me know. I'd be glad to try and help.